now we're on to the next flow sheet. We're going to be doing past medical history. And just a quick tip, so I clicked now, I'm going to go ahead and click document. It may be best to watch these videos, I'm trying to keep them to 5 minutes or less, I'm trying to keep them in the 3-minute range if possible. It may be better to kind of watch the video, absorb everything that's going on. Since it's one of the first times you're seeing the flow sheet, you can just kind of absorb what's going on with the flow sheet, what sections they have, about how long it is, maybe kind of what percentage of the flow sheet categories or lines are actually documented. You know, maybe only 50%, maybe 90%, maybe even as low as 20%. It's a lot of pieces that maybe get skipped because they're not appropriate. It's a lot of pieces that gets included if you click in one specific piece. Like if this is yes, then more, like for instance, patient is at risk for Ebola, contact charge nurse immediately. More may be involved. Like if you click some of these yeses, isolate patient, initiate Ebola protocol immediately, it's going to, sometimes it'll pop open this whole section for you automatically. But just a tidbit, and maybe the best way to do it, just to watch the video first and then use the paper handout to go back and kind of do the same documenting on your own. But of course it's always up to you and how you learn best and how you feel is the best way for you to do it. So past medical history is pretty straightforward. We're just documenting, of course, the problems that the patient has had medically in the past. So for this example patient we have, of course, have they traveled outside of the country in the past 12 months is no, Ebola risk is no, and Ebola symptoms is no. And of course, since the answer here is have they experienced symptoms, no, then we really don't have to check any of these. So you'll see little things like this throughout Meditech, like for instance the category none really maybe doesn't make any sense, because if you're going to put yes, you wouldn't put none, and if you're going to put no, then you wouldn't answer the category at all, really. Notice when we click yes, this star appears, Ebola system experience, or I'm sorry, Ebola symptoms experience. So when we just watch that star, as we click from no to yes, it disappears. So just something to watch out for. So we'll go with no. And again, this is something we don't really have to address, exposure. It's going to give lots of details if these answers were yes. So since it's no, we can ignore all that stuff. So history of MRSA and VRE for this patient is both no. So we'll scroll down here. And feel free to take your own time, pause the video, take your own time to look more closely at this flow sheet if you would like. So the only yes we have here is burns. So normally we would put a comment for burns, you know, might say 2nd degree to right hand 10 years ago, something like that. And then everything else here is no. So again, I kind of like to tab, use my arrows and space bars. Once you get good at it, it'll fly through. There is some debate on whether or not we should answer no to all these or not. Some people will tell you no, but of course that's up to the discretion of the director. Some people think if you don't put no, then it's like you have no proof that you addressed it. But so the next yeses we have are bronchitis and asthma. So what we'll do is we'll do that, and then we'll kind of start clicking no. Sometimes it's easier if you address the yeses first and then go back and click all the no's that are not the yeses. So this patient has these 4 yeses: CHF, chest pain, hypertension, and palpitations. Whoever filled this one out originally actually put AFib here for a comment, so it's best that we click the yes. Looks like there's not actually a yes or no clicked there, but we'll click yes, and then of course fill in all the rest of the no's. Okay, now we're on musculoskeletal. So our next 2 yeses are arthritis and appetite changes, and then everything else is no. like alcohol abuse is the last yes, and everything else beyond that is no. So we'll just do some speed clicking. And that pretty accurately sums up what the example from the patient on the sheet has. So that's the end of that, past medical history. Next one will be the admission assessment, adult admission assessment.